This is a true story. This is the story of achievements of the Iranian local health workers and their remarkable efforts in controlling malaria, a communicable disease which has been prevalent in the country for centuries, threatening lives and the development efforts of the nation. Malaria has been a widespread endemic disease in Iran for a long time. By the early 20th century, the disease was the most important public health problem in the country. For proper addressing to the challenge, the nation was united to implement a national eradication program that was started in 1956. However, by combining various interventions and products, the program succeeded in reducing malaria considerably, even in the deprived southern regions. But unfortunately, the number of reported malaria cases in Iran reached a high of 98,160 in 1991. By 2010, after implementation of the malaria control program, the program was again reoriented to national elimination. Since then, through hard work of the dedicated national malaria elimination teams, the burden has been steadily declining. The number of indigenous reported cases reached as low as 92 in 2016, 57 in 2017, and 0 for 2018 and 2019. There is a concern that imported cases may impede the progress towards elimination by the incoming migrants who are residing in remote areas of the southern parts of the country. Let's have a better picture of malaria. Malaria is a serious public health problem in many parts of the world. Attacks of the disease can be severe and can lead quickly to death if untreated. Lack of knowledge about malaria, poverty and chronic disease together form a vicious circle, which is difficult to break. In the mosquito vector, the parasite life cycle lasts for 1 to 3 weeks, depending on the number of factors, such as the malaria parasite species, the ambient temperature, and the relative humidity. It is transmitted from one person to another by the bite of female Anopheles mosquitoes. Malaria is caused by a small living organism called a parasite, which infects a person's red blood cells. In the past few years, attempts have been made to control the disease through the use of insecticide-treated nets, prompt diagnosis, and appropriate treatment. Prompt diagnosis and treatment is the most effective way to prevent a mild case of malaria from developing into severe disease and death, especially for those migrant workers and people who are sleeping uncovered in farms. The disease is reasonably easy to recognize in people who have not had malaria before or have had few attacks. The common symptoms of malaria are high fever, headache, severe chills or rigor, profuse sweating, and general body pains. Some patients may have vomiting, cough, or diarrhea. In persistent and recurrent infections, anemia may be present. Effective surveillance of malaria cases and deaths is essential for identifying the areas or population groups that are most affected by malaria and for targeting resources for maximum impact. Despite the fact that a strong surveillance system requires high levels of access to care and case detection, in the Islamic Republic of Iran, volunteers and health workers of the local communities are the pioneers of the case detections and early surveillances. In most village, district, and provincial malaria laboratories in Iran, diagnosing malaria is happening through microscopic examination of a patient's stained blood film by a trained microscopist. Additionally, a broad range of methods were practiced by the local health workers in Iran, including Spraying on the walls of houses, fogging in farms, or distributing of mosquito bed nets donated by WHO and other international organizations in high-risk areas. Environmental measures to eliminate water bodies that serve as breeding sites, drying out the ponds, improving irrigation practices in the farms, covering water sources and reservoirs of fresh water. Releasing ambrosia fish that eats mosquito larvae. The fish is usually bred and released into small rivers and lakes, and larvicides applied in breeding sites. Thanks to these persistent efforts, the Islamic Republic of Iran has reported 0 indigenous cases for 2 consecutive years, and hopefully it will very soon become one of the countries that succeeded in elimination of malaria. And this is the result of dedication and sacrifices by the local health workers in the fight against malaria in Iran.